Bismillah ar-Rahman ar-Rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatam min lisani yafqahu qawli. I am Dr. Motasim Billah, Assistant Professor in Anatomy, the Yukhan Medical College, Saudi. We will discuss today. Topic for today's discussion is birth defects. The learning outcomes of this lecture should be that by the end of the lecture, you should know to define birth defects. What are birth defects? To describe how these defects occurs, and to know the common causes of these defects, and to know its prevention, how to prevent these birth defects. And if they occur again, even then how to manage these birth defects accordingly. Birth defects is a very broad term, and it is usually English term. That the defects we see at birth of the baby. By definition, these defects could be of any variety. They may be structural. There may be defect in the function, or there may be a defect in the behavioral, or there may be a defect in the metabolic disorders and different chemical reaction present in the body at birth. So comprehensively, we can say that these are the structural, functional, behavioral, and metabolic disorders which are present at the time of birth. They are present at the time of birth, and they have occurred in the baby at the time of its development. So these are also called congenital malformations. And again, as they are abnormal, so we call it congenital anomalies as well. So the birth defects, the congenital malformations, or the congenital anomalies are the terms, different terms with the same meaning. Study of such anomalies is the subject which is called teratology. The study of such anomalies which occurs at the time of birth, this is called teratology. And those scientists who works in these fields, in this field, they are called teratologists. And the process in which these birth defects have occurred, this is called teratogenicity. Teratogenicity. We will describe some terms which we use synonymously. For example, malformation. We see malformation. Formation is something normal, and malformation is actually abnormal formation. So it's an abnormality acquired during development. The development was not normal, and there was some deviation from the normal development. This is called malformation. The cause for this malformation could be either genetic alone, or environmental alone, or in combination with each other. What is deformation? That was malformation, now deformation. Deformation, you can say that formation was normal, or there was a normal formation, but it has been deformed due to some reason, which is usually caused by mechanical forces, which change the shape of a part of a fetus, which was, though developmentally it was formed normally, but it has been deshaped due to certain forces. The examples of deformation are clubfoot. The structure is normal, the muscles, the ligament, the vessels, and the bones are normal, but they have been D-shaped in the form of a clubfoot, or Talipes equinovarus, or congenital Talipes equinovarus. These are the abnormalities caused by the mechanical forces, which is D-shaped a normal part of a fetus. This is called deformation. The other is disruption. Disruption, what's disruption? Actually, the development is normal and it has formed normally, but some destructive processes in the prenatal development causes the change in the shape of that part. The formation is normal, but some destructive process is going on in the prenatal development, which causes the change in the shape of that part. For example, the limb amputation, which is caused by the amniotic bands. There is condition in which, due to the formation of the amniotic bands, the limb is stuck somewhere and its vascularity is damaged, and it is become granular, and then we can say that limb amputation has taken place. Or there is vascular accidents inside, it will cause the intestinal atresia. These are the examples of disruption: limb amputation by the amniotic bands or the intestinal atresia by vascular accidents. The other term is the syndrome. Apart from malformation, deformation, and disruption is a syndrome. Syndrome is defined as a group of anomalies occurring together, and they have a specific cause for that. So syndrome is not a disease, it is a group of anomalies that occurs together with each other in association, and they have a specific cause. For example, Down syndrome is the abnormality of the chromosome in numbers. Down syndrome, we call it trisomy 21, or this is a trisomy in addition of one extra chromosome. Edward syndrome, again, there is an addition of an extra chromosome at the level of 13. Trisomy 13 is called Edward syndrome, and trisomy 21 is called Down syndrome. They have specific features. Each Down syndrome is caused by the trisomy 21, and he may have specific features for that. We have already discussed all these things in the chromosomal aberration. Turner syndrome is another example of a deletion of chromosome. Turner syndrome, an individual of a Turner syndrome will have a one chromosome less than the normal, and this is called Turner syndrome. And each Turner syndrome will be caused by the deletion of a chromosome, and he will be having the specific characteristics for for this deleted chromosome, and this is called syndrome. So syndrome is a group of anomalies that occurs together, and they have a specific cause for that. What are the causes of birth defects? Why they occur? Why some babies are delivered normal and others are defective? So the reason on the top is that of genetic, that the DNA play a major role in this. This genetic could be in the form of a single gene defect. There will be a problem in the single gene, and that defect will be presented. For example, the autosomal dominant condition that is called dwarfism or polydactyly. This is due to a single gene which is autosomal dominant. It will express itself if it is present. The other is autosomal recessive. That it will be autosomal, but it will be recessive. If the normal is there, it won't present itself. But if the normal is not there, it will express itself like albinism, like microcephaly. The other defect, the other example of single gene is the X-linked recessive character, X-linked recessive defect. As it is X-linked, so it will be not expressed in males. Sorry. It will be expressed only in males, because in female we will be having two X's. So one X will be recessive and the other will cover it, and it would present yes. If it is transferred by a process of gametogenesis to the offspring, it may express itself there. So the X-linked recessive character like hemophilia, like muscular dystrophy, it is usually not present or not expressed in the female. It is, we can say it's the disease of the males. But if this female is married, X-linked recessive character, female is married with normal person, and if the combination of the coming offspring is XY, so this X will express itself in a form of a disease in that offspring who is a male. Understand? This genetic abnormality will be in the chromosome in the form of numbers. Either the number of chromosome will be more than normal or they will be less than normal. The other possibility is that of a chromosome and structures, either they will be deleted or some part of the chromosome will be deleted and it will present in the form of a disease. Another occasion, some part of the chromosome will be added to somewhere and it will be presented in the form of a disease. Sometimes the chromosomal shape will be abnormal. It will be in the form of a ring or thing like unusually lengthy or unusually short. In numbers, we can give the example of monosomy, where the chromosome number is less than normal. For example, Turner syndrome. Here, there is a there's a problem in the 6 chromosome pair, and one chromosome is less, and we presented that the total number of the chromosome is 45. It is not 46, one less, and it is presented as a 45X4, and it is Turner syndrome. So all the abnormality of Turner syndrome will be there if there is a one chromosome less. If one chromosome is more than normal, for example, trisomy, as we have discussed in the previous slide, if it is at the level of 21, it is called Down syndrome, that is trisomy 21. If it is at the level of 18 pair, we call it trisomy 18 or Edwards syndrome. And if it is at 13, we call it Pachau syndrome. This trisomy or addition of a chromosome may be possible with the 6 chromosome as well. If the 6 chromosome either more or less. In the list, we have given the example of Turner syndrome. Now, if it is more, it could be, the combination could be 47XXY. One chromosome is more, and in the place of XY, it is XXY. Probably it is due to non-disjunction of the female part during fertilization. It is called 47XXY, and it is called Klinefelter syndrome or Klinefelter syndrome. And sometimes it is in the form of 47XXY, XXX, and it is also called triple X syndrome. So these are the examples of the chromosomal abnormalities in numbers. So these are main responsible for the birth defects. Now, the environmental factors are also very important. Any agent that induces abnormal prenatal development is called teratogen. We told earlier that teratology, teratologist, teratogenicity, so now is teratogen. Any agent that induces abnormal prenatal development is called teratogen. And the process of abnormal production in the embryo or fetus is called teratogenesis. Okay. So we will discuss all the factors which are responsible for the teratogenicity or the birth defect of the embryo. How we classify these teratogen? We can classify it in the form of drugs, which are either for the treatment, therapeutic drugs, or they are social drugs. Increased temperature, hyperthermia, ionizing radiations, the condition of the mothers, all these play a role in the causation of the birth defects in the newborn. Of the drugs is it's an essential part of the life, and human being suffers from a lot of diseases, and it should be treated. So we will take few examples from that. For example, anticonvulsant drug, which I used in the treatment of epilepsy, which is a very important drug, and that was phenytoin and its derivative and valproic acid. So, with the prolonged use of these things in pregnant ladies, it was proved that it causes growth retardation of the fetus with the other development of the face that is called facial defects. Antibiotics, which all the time we are using in one way or other, rather we are not using antibiotics, we are abusing antibiotics nowadays. Tetracycline and streptomycin, which are not used nowadays, but it was a major therapeutic antibiotics in the past, and they have a definite teratogenic effect. All those pregnant ladies who use this tetracycline and streptomycin, particularly in the first trimester and early developmental stage of the embryo, they cause problems they produce birth defects in the baby. Anxiolytics to reduce anxiety and to treat depression. These are anxiolytics and antipsychotic, both these are. Thalidomide were used in the past, and it was very well known for the defects in the upper and lower limb structures. They were either not developed, or if developed, it was minimal in length and size. And they were called amelia if there is no limbs at all, or gyromelia if they are too small. Similarly, the antipsychotic drug that is called chlorpromazine, trifluperazine, that causes cardiovascular anomalies if used by a female in pregnancy. Anticoagulants drug, which decreases the viscosity of the blood, and it is a main drug used in the treatment of hypertension to avoid the thrombotic phenomena or thrombosis. And even specifically nowadays in COVID era, this anticoagulant has become more important again, because they say that the mechanism of the COVID mortality is this thrombus formation in the blood and the failure of circulation to the important organ, for example, brain, lungs, kidneys, etc. So anticoagulants are also notorious for the development of birth defects in babies. There's warfarin, it causes optic atrophy. It causes nasal hypoplasia, and it is responsible for the mental retardation of the baby. Similarly, the ACE inhibitors, which is called angiotensin converting enzymes inhibitor. And this is a group of drugs which is used in the treatment of hypertension. But in pregnant ladies, it causes intrauterine growth retardation. Inside the womb, the growth will be retarded, and it causes bone hypoplasia. It may dip the kidneys, cause renal dysfunction, and also causes oligohydramnios. The commonly used analgesics, for example, paracetamol, Ponstan, Panadol, if used in large doses, they are also teratogenic and they cause birth defects in babies. Vitamin A, the fat soluble vitamins, which is used in the variety of skin diseases like acne, it is teratogenic and it causes problems. The derivative of the vitamin A, which is called isotridenine, it causes hydrocephalus. It causes the maldevelopment of the jaw, and it is responsible for the cleft palate and various cardiac anomalies. Antineoplastic drug. Nowadays, the cancerous process are many different systems have been affected, and the treatment is very important. It should be treated, but it is highly teratogenic in the first trimester of pregnancy. So the choice should be to terminate the pregnancy in these conditions, because there will be high chance of teratogenicity in the babies. Because this antineoplastic drugs, they block the DNA synthesis and rapidly dividing cells, and they also kill the rapidly dividing cell. So in the first trimester, when all the systems are forming, for example, there is neural tube formation, and then the development of the brain and spinal cords, and the development of the heart and all these things. So it affects all the procedures and all the processes and is responsible for the birth defects in different systems. Hormones, which are usually not considered as teratogenic, but the studies on mice were proved that the steroids are teratogenic, and it has got the weak teratogenicity in human cells as well. Similarly, progestin, it has got the masculinizing effect on female genitalia, and it is the main problem later on. So the use of all these drugs should be used very cautiously and on the basis of needs. Social drug, which we don't use it as drug. For example, smoking. We do smoking as a habit. It contains nicotine. It is by itself not proved to be teratogenic, but it causes the growth retardation inside the uterus. Cocaine, majority of people use it. Again, if it is used by females in the early pregnancy or the first trimester, it causes intrauterine growth retardation, also causes urogenital anomalies. And it also causes microcephaly, the small brain and small skull. Alcohol, majority of people take it. It also causes growth retardation. It causes microcephaly, defective development of the brain. It is responsible for the different heart defects and craniofacial anomalies. For example, maxillary hypoplasia and the defective development of the lower jaw. Environmental chemical that we used, they are used all around and we are exposed to that. Industrial pollutants, we are always exposed to all these different pollutants. The food preservative we are using to store the food, and the pesticides which spray it on the plants, all these things are environmental chemical and they may affect the pregnancy and it may cause the birth defects. Radiation in the form of the X-rays, unusual exposure of the rays, for example, X-rays, CT scans, and irrelevant investigations. It kills rapidly dividing cells, and it is definitely teratogenic. Hiroshima and Nagasaki incident, 1945 World War. After the bomb blast, the survey was conducted, and about 28% of the pregnancies at that time was spontaneously aborted. 28% of all the pregnant ladies aborted. Of the remaining, when the babies were delivered alive, 25% of the affected babies were died in the first year of their life. And of the remaining, a major contribution, that is 25% of babies, they suffered from severe central nervous system anomalies. So radiation is a very teratogenic effect, and the extra exposure to radiation is very serious in pregnant ladies. They should not be exposed to X-rays, to CT scans just for nothing. Infectious agents can cause the birth defect in the pregnant ladies and the fetus. Of those, the viruses are most common because viruses cross placental barrier and they directly affect the fetus. For example, rubella causes German measles in the past. And there was a triad of defects. Defect in the eye in the form of cataract, defect in the ear in the form of deafness, and other cardiac defects as well. CMV, cytomegalovirus, it causes abortions. It causes intrauterine growth retardation. Again, it affects eyes in the form of blindness and ears in the form of deafness, and it causes mental retardation as well. HIV causes again intrauterine growth retardation. It again causes defective development of the brain. Varicella, it causes muscular atrophy and again mental retardation. Hepatitis is very common of different varieties. Of those, hepatitis B has a high rate of transmission to fetus and a high risk of fetal hepatitis is there. On the other hand, hepatitis A, C, and E are rarely transmitted through the placenta. Coxsackie B viruses, it also causes spontaneous abortions. A high grade of fever in the very early pregnancy, 102, 103 temperature in early pregnancy, causes neural tube defects. And ultimately, it will end up in anencephaly and spina bifida, which are the very serious birth defects. Bacterial infections usually do not cross placenta and they do not cause teratogenicity. That is the virus's root. Now, the new viruses that of COVID, so with the passage of time, it will be known that how much it affects and how much responsible the COVID is for the congenital birth defects. The baby will have, Treponema pallidum, which causes syphilis. It can cross placenta after the 20th week and causes congenital syphilis. Only Treponema pallidum, when the placenta becomes mature, after 20th week, it can cross the placenta and cause congenital syphilis. And the baby will have a hydrocephalus. The baby will have a hydrocephalus, mental retardation, and deafness. Parasitic infection, although the toxoplasma can cross the placental barrier and cause birth defects in baby, in particular in the brain and eyes, that is microphthalmia and microcephaly and hydrocephaly. So toxoplasma, which is a very treatable infection, if it occurs in mother, it can cause the placenta and may be responsible for the birth defects in the babies. So it should be promptly treated, it should be promptly investigated and promptly treated to avoid or to prevent this birth defects caused by this treponema and toxoplasma. Of the causes which responsible for the birth defect are the maternal causes as well. Maternal causes, we discussed the one, if there is a hyperthermia, high grade temperature in the first trimester, or the female uses this analgesic without any necessity, it is not indicated and it should be avoided. Diabetes is a chronic disease, and if the mother is diabetic, malformation in cardiovascular and skeletal system is possible due to this diabetes. If the mother is malnourished and there is, particularly there is folic acid deficiency, the folic acid deficiency will lead to a neural tube defects. Because a survey was done in America, those mothers who were folic acid deficient, there was increased chances of neural tube defects, and they made a protocol that every childbearing age female will have a folic acid even before pregnancy, and recommended a dose throughout the pregnancy. So these neural tube defects were then reduced in an incidence. Iron deficiency, which is very simple, malnourished people have. Iron deficiency will lead to cretinism and retarded growth. There will be a short and broad hands and short fingers like this. So it can also be avoided. The pregnant lady should be given iron products, and it should be given with folic acid. So both the problem will be overcome. How can we do the prenatal diagnosis for the birth defects? This is very important. How we will know that this baby may have the problems. So, intrauterine fetus is a living human, and it is exposed to all conditions like any other living beings. Its growth and development should be assessed periodically, and its malformation or genetic abnormalities and fetal growth should also be assessed. Similarly, the complication of placenta and overall pregnancy period is to be assessed and managed. So we can say that the fetus should be taken as a living human, and he should be treated as a patient. If he is or she is some problem, we should assess and we should handle properly. Tools for assessment are many. For example, we can use ultrasound. We can do the serum screening of the mother. We can do the Chronis-Willis sampling. We can do the analysis of the amniotic fluid. So we will discuss a few points about each. Sonography, or we can say ultrasonography. This is very effective, and this is very valuable in a sense that it is non-invasive procedure. No harm in that. It is non-toxic, and above all, it is non-teratogenic. It has got no teratogenic effect that it will cause the problem in the coming baby. So it's a non-invasive procedure. It is non-toxic. It is non-teratogenic. It is cheaper, and ultrasound machine is easily available everywhere. So it is a very simple investigation tool, and it is very valuable as well. We can do a lot of with this ultrasound. We can determine the fetal age by different parameters. For example, the crown rump length. By the crown rump length, we can see that the duration of the gestation or the fetal age is about this much week. Approximately, we can see with plus minus few days. BPD, we can measure the biparietal diameter of the baby. And again, there is a computerized chart in which we can say that if the BPD is this much, the fetal age will be this much. The other parameter is femur length. We can again point out the femur, and then we can measure the femur length of the femur, and we say that this much age of the fetal should be. Again, we can see by this ultrasound probe the position of the placenta, where it is frontal, or it is placenta 1, or 2, or 3. There are multiple grades for the placenta. Placenta previa is the abnormal one, and it is grade 1, 2, 3, 4. We can see the amniotic fluid as well, and we can assess that this amniotic fluid is normal, or it is less than normal, or it is more than normal. There are different conditions in which we can detect these things, that polyhydramnias are the reason of this disease, and oligohydramnias is the cause of this disease. So we can point out and we can direct ourselves to that particular diseases to manage. The very important, we can see whether the fetus is one or more than one, the presence of multiple pregnancies. And the presentation of the fetus is something else, that how it is lying, whether it is transverse lie, it is longitudinal lie, the head is up, the head is down, so it is called presentation of the fetus. All these things are abnormal, and all these things are very important, and we can see through our eyes through machine. Congenital anomalies, we can appreciate that is anencephaly, fully mature state. You can say that he has no skull or no brain. They are called anencephaly. Or there's an excessive fluid in the skull that is called hydrocephalus. There could be neural tube defects. There may be spina bifida as well. And if some person is very expert, he can see the cleft lip and palate, polydactyly and syndactyly, everything. But it depends on the operator, the skill of the operator. It is the only investigation which is operator dependent. If the operator knows more and he is more skilled, he will point out the more things, more anomalies. Heart activity and overall movements of the fetus can also be appreciated by these investigations. So it is very valuable in the sense that we can see and we can assess the mother and the fetus as well. The other procedure, amniocentesis, as I told you, amniotic fluid. We can aspirate the amniotic fluid from the amniotic cavity, and we can analyze this fluid, and we can measure this amniotic fluid for different diseases. We can analyze this for different diseases. This procedure is ultrasound guided, because we have to see via the ultrasound that where is the amniotic cavity and where is the fluid. Though it is a risky procedure, that is why it is not recommended before 14 weeks of gestation, because before 14, the amount of amniotic fluid is less and there are more chances and there is more risk that the needle may hit the fetus directly. But with the passage of time and with the high skilled and high skilled people, the risk in highly skilled center is less than 0.2 to 0.3, and we can do this amniocentesis for different studies. In this, we can study the cells for different things. Amniotic fluid is analyzed for AFP, alpha fetoprotein. Alpha fetoprotein is normally synthesized in the liver, and then it is going then leak through the placenta into the maternal circulation and to the amniotic fluid as well. So if we take amniotic fluid, we can measure the alpha fetoprotein, and the amount of alpha fetoprotein may indicate some disease. Fetal cells in this fluid, amniotic fluid, may come out, and they are used for karyotyping and other genetic analysis, and we can detect different chromosomal anomalies as well. If chromosomes are obtained in this sample and studied, then different anomalies can be identified. Nowadays, in more advanced studies, for example, molecular analysis, in molecular biology, we can do PCR, that is polymerase chain reaction, and other genotyping, and in which the level of detection of genetic abnormalities has further increased. So, before birth, pre-natally, we can diagnose what are the conditions of the baby. Maternal serum screening. We take the blood from the mother and then we do serum screening. It can be used as biochemical marker. Again, alpha-fetoprotein, which is normally synthesized by the fetal liver, and then it leaks into maternal circulation by placenta. The level of the alpha-fetoprotein rises in different conditions. For example, neural tube defects, omphalocele, umbilical hernia, and the abdominal wall defects, gastroschisis, the abnormal development of the stomach, sacrococcygeal teratomas, and also the gut atresia. In all these conditions, the level of the alpha-fetoprotein in the serum of the mother increases. This level may be decreased in the Down syndrome. If the fetus is having Down syndrome, the level of alpha-fetoprotein decreases. If there is Edwards syndrome, after there is 6 chromosome anomaly, again, this alpha-fetoprotein will be decreased. The other is chorionic villus sampling. It's an invasive procedure again. We aspirate the villus tissue or the tissue from the placenta, ultrasound guided from the placenta. It is again a risky procedure and may cause a severe bleeding, and it is a time-consuming process. And there is a risk of loss of that pregnancy as well. Previously, these invasive investigations were not indicated in normal cases and normal pregnancies, but it was only indicated in high-risk pregnancies. But now, the American College of Obstetrics and Gynae recommends these investigations in all women for aneuploidy, which is the chromosomal disorders and numbers. I have told you about the polyploidy, aneuploidy in the beginning of the lectures, in the first lectures, probably first 2-3 lectures. High risk female कौन होते हैं? High risk female for anomalies. When you expect that anomalies will be there and she should be treated and she should be observed and assessed periodically. These are the number one is the maternal age. Above 35 years, the complication of the pregnancy are increased, and the anomalies of chromosomal anomalies are increased. Number 2 is the maternal disease. If the mother is diabetic, so there are chances that the baby may have chromosomal anomalies. If there is a previous history of genetic problem, if she is having a baby, first baby of genetic problem, so there are more chances that she will have another one as well. Again, any abnormal ultrasound findings are the serum screening test. If it indicates some risk, so these are called high-risk females for the anomalies, and these type of, for example, old age pregnant ladies with different comorbid condition like diabetes, hypertension, and if particularly there's a previous history of genetic problem, and if an ultrasound, if there are abnormal findings. So these are the high risks for anomalies. So the take-home message is that it was an effort to highlight the importance of birth defects in its prenatal diagnosis, the importance of its prenatal diagnosis, and to some extent its prevention and its management if it occurred. Thank you. Thank you very much. Allah Hafiz.